Hello and welcome, colleagues, patients, and friends and virtual attendees. My name is Andrew Callen, and I am very honored to be here today as the course director for this year's Spinal CSF Leak Bridging the Gap conference. Before we begin, I really want to express my gratitude to my fellow organizers, Jen McKenzie, Jody Ettenberg, Dr. Lalani Carlton-Jones, and Dr. Marius Berlea. I also would like to thank the Spinal CSF Leak Foundation and the Departments of Neurosurgery, Radiology, and Neurology at the University of Colorado for their invaluable support in making this event possible. I would also especially like to thank our many international speakers who have traveled very far to be here today and tomorrow. We are incredibly grateful for your presence. Last year, we took a major step forward with our inaugural event, bringing together 70 in-person attendees and over 500 virtual participants from across the globe. This year, we've grown in both scope and scale, with double the speakers and 2 full days dedicated to the past, present, and future of spinal CSF leak research and treatment. We have attendees from 32 different countries listening in. We also are fortunate to have speakers from 6 different countries, each contributing their expertise and experiences to deepen our understanding of this complex condition. This year, as we reflect on the past, examine the present, and look towards the future, we're not just charting a course based on what we already know. We are building a roadmap guided by the wisdom and stories of those living with this condition. Our patients are not just recipients of care, they are partners in this journey. Their narratives help shape the questions we ask, the innovations we pursue, and the treatments that we develop. In thinking about the importance of listening to patients, I'm reminded of 2 pivotal moments in medical history. The first is the story of Dr. James Lind, an 18th century physician who revolutionized and discovered the cure for scurvy. Sailors were dying at alarming rates from this mysterious disease, and while many remedies were proposed, none consistently worked. Lind, however, chose to listen carefully to the experiences of these sailors and consider their diet. Through one of the first controlled clinical trials, he discovered that citrus fruits could cure scurvy, transforming the way this disease was treated and saving countless lives. The second story is that of Dr. Oliver Wendell Holmes Sr., who revolutionized our understanding of childbed fever in the 19th century. At a time when many women died after childbirth, Holmes suspected that physicians themselves were spreading the infection. His observations based on patient accounts and patterns of infection led him to advocate for better hygiene practices among doctors. Though his ideas were initially resisted, they eventually became accepted, fundamentally changing the way we approach infection control in medicine. As clinicians, we often seek certainty in data, the imaging results, the lab values, the treatments that have clear, measurable outcomes. Yet the truth is that some of the most profound insights come from what is not immediately measurable, the lived experiences of our patients. These experiences are rich with knowledge that can challenge our assumptions, expand our thinking, and guide us toward more meaningful care. Our task, today and always, is to allow those stories to reshape our understanding of this complex disease in ways that technology alone cannot. Over the next 2 days, we have the unique opportunity to break down the traditional barriers between patient and physician. This conference offers us a chance to sit with our patients' experiences, to listen without the urgency of treatment, and to let the voices influence the future of our practice in a way that is grounded in empathy and mutual respect. I hope that by the end of this conference, each of us feels not just more informed, but transformed. The science will continue to evolve, as it always does, but the way that we approach our patients and their care has the potential to change today. Thank you all for being here, for your dedication you show to this field, and for your willingness to explore new ways of understanding and treating this condition. I'm looking forward to what promises to be an engaging and enlightening 2 days.